Hello, everyone, and welcome to Conversations with Kathleen. I'm Kathleen Ryan, President and CEO of Mount Nittany Health, and today's topic is the new patient care tower that's being developed here at Mount Nittany Medical Center. I'm so excited because you've asked a lot of questions, and this evening we're going to try and answer your questions. So, I'm really proud, pleased to be part of an organization that has the vision, the passion, the determination to take on large game-changing projects. And certainly there's certainly no taller project that we have going on at Mount Nittany Health than the development of a new patient care tower here at the medical center. You have asked a lot of questions about this project since we've gotten started, and I've got an expert panel here this evening with me to answer those questions. Here with me is Kim Kennedy, Rick Slebodnik, Amber Shaw, Dallas McKivison, and Dena Johnston. So thanks to all you guys for joining me this evening. So let's jump right in with a question a lot of people are asking, and that is, why are we doing this? And Rick, I'll ask you to take that question.
Okay. Thank you, Kathleen. Wow, so many reasons. I guess the first thing for me that comes to mind is every day we come in, we're here to take care of patients. To me, this is an investment in our patients, in our communities, and all those staff that care for all of those patients in our communities. A number of other reasons. I mean, obviously to replace an aging infrastructure. This new tower will provide us all private rooms, 100% private room placement. We're looking to align Mount Nittany Health with the latest in healthcare delivery trends, but also technology trends as well. So also with the project, we get to gain some efficiencies with not just our inpatient units, but also some outpatient services as well. So but I mean, all of these factors lead us to staying as a healthcare leader in the region and just providing that best healthcare and patient experience for everyone.
Great, thanks, Rick. Amber, a question for you. This comes from Derek Owens from the PACU. And he wants to know, when developing the tower, was there a multidisciplinary team that was involved? And did they weigh in on things like blueprints for hallways, nursing stations, public areas? And he says, by multidisciplinary approach, he means, did it include staff like RNs, CNAs, environmental services, pharmacy, et cetera? He wants to know if representatives for all departments and those that take care of patients will be, have been and will be involved in the design.
That's a great question and a very important one. Currently, we're in the development phase of the project, so we haven't yet reached the blueprint phase. We're definitely planning on having members of the front line included. Currently, there's about 40 members of the initial team. Our first plan was assessing all of the areas that we currently have in the hospital: the patient's rooms, staff amenities, kitchen, dining areas, breast care center, MTU, the anti-coag clinic, speech therapy, our current telemonitoring capabilities. We've also looked at similar facilities and what they have available to them. As we move forward, all areas have identified team members from the frontline staff, and they will be included in the further project planning before we actually break ground next summer.
Very good. Thanks, Amber. Rick, back to you for a question about staffing. This comes from Megan Reed, who works at endoscopy, and Samantha Stradiff from the progressive care unit. And they both want to know, how do we plan to staff the new tower?
Okay, thank you. So for staffing, one of the things, again, to keep in mind is that we're not increasing our bed capacity. We're going to maintain the same number of licensed beds. It will just be in an all private room format in the new tower. So we will take our existing staff and basically reallocate that to the tower to those care areas. Now, I mean, one of the things that we are excited about is with this new project, we'll gain some improved workflows, some better efficiencies, and that can also help in as we map out that staffing moving forward.
Thanks, Rick. Dena, here's one that I think is for you. It came in anonymously. And this question is, will the private rooms in the new tower serve the general patient population?
Absolutely, Kathleen. We intend to use the same process that we use right now for patient placement. There will be an ICU, PCU, the med surg areas, and an orthopedic area. So just as we do right now, whatever level of care is ordered by the provider, that's how we'll place the patients.
Great, thanks, Dena. Here's one for Kim, and this is a question that I've heard a lot when I'm out and about in the medical center. Specifically, this one comes from Kayla Armistead. She's a clinical dietitian in nutrition services, and she says she's been told that the new tower is being built where the healing garden is. So she wants to know, will there be alternate outdoor space for patients and families and staff to use while the tower is being built? She would love it if the outdoor space had access to Wi-Fi so that Tiger Connect Meditech could be accessed if needed. And she talks about how she and other staff just so enjoy being able to get outside, and could be difficult to do that when the tower is being built. Same question, similar, from Joseph Stormer, an occupational therapy, who says he loves to have lunch outdoors when the weather permits. So what seating is planned outdoors in the new spaces? So Kim, let me ask you to take that.
Sure. Great questions. And I actually hear those quite frequently as well. So during planning, we have absolutely looked at outdoor spaces and capabilities. There's plenty of them planned with the tower for not just patients and visitors, but also for staff. And these are located on balconies and on the main floor. As far as the impact of outdoor spaces during construction, it was an important consideration that we weighed while making the decision to construct the new tower. Our goal is to improve the overall staff experience and provide space where staff can find respite, including outdoor areas. During construction, there may be times when certain areas are closed or inaccessible, but alternative spaces will be made available for staff and visitors to the medical center.
Thanks, Kim. Rick, a question for you. What's going to happen to the space that we vacate in the existing medical center?
Okay, thank you. At this point, some areas will stay where they are in the current buildings, such as our recently open beautiful women's and children's units. Those spaces will stay the same. We'll continue to evaluate options for some of the other spaces. I mean, it could be new programming, could be support spaces, could be a number of options. A lot of that probably won't be completely mapped out until sometime mid to late next year, I would imagine.
All right, very good. Thank you for that. Kim, here's a question for you again. This is Carla Robinson, who's an RN on the IV team. And she has a few questions that are really specific. She wants to know about lighting, temperature control, access to warm water, where the electrical outlets will be placed, procedures, workspace in the patient rooms, and storage. All of her questions are relating to the design and the ability to improve the patient experience. So can you take a shot at that?
Sure. We are actually currently in the design development phase of this project. So the specifics of the room layout and design haven't fully been decided. Over the coming year, we'll be working with frontline staff members who actually occupy those spaces to define and refine the layouts. At this point, given the overall building plan and placement, we do know that the design will bring natural light into the patient rooms while capturing the spectacular views of nature. It will also have an efficient floor plan, 1,600 square feet, 16,000 square feet, I apologize, a central utility plant that will replace aging infrastructure.
Very good. Thanks for that. Number of questions about food and dining that'll be available for patients, for staff, and for visitors. So Dallas, can you talk about what the plan is for food service, please?
Sure. There'll be an enhanced dining and food service department. It's involving the kitchen, servery area, and a dining area. The kitchen's going to be located on the ground floor, covering about 7,500 square feet, along with the servery and dining area, which will be on the first floor. It'll be covering around 8,600 square feet, with over 5,000 of that being dining space, with also an option of a balcony, which will be connected to the dining area of an additional 5,400 square feet.
Wow, that sounds just absolutely terrific. Thanks for that. Number of questions here from Samantha Stradiff again, so from the PCU. And she wants to know, Amber, specifically, what do we mean when we say enhance the staff experience?
So a lot of the conversation in the initial phase of this has been ways to improve employees' well-being. That includes things such as consideration when we're talking about the floor design, making sure that that's user-friendly, up-to-date treatment areas, amenities. There will be indoor and outdoor areas that will give staff relaxation time, even as far as the location of break rooms and things like that to be user-friendly.
Very good. And Samantha's also asking, will the tower be separated into telemetry units and non-telemetry units like our current design is? Dallas, I'm going to ask you to take that one.
Sure. All 168 patient rooms in the bed tower are going to be designed to have telemetry capability.
That's terrific. That will be a big improvement to have telemetry everywhere. That's great to hear. Samantha also wants to know if we're still going to have ways to get the blood samples over to the new lab, which is over the pharmacy.
At this time, that level of detail hasn't been worked out yet, but we'll be working with the employees in the new tower to develop the best way to handle samples and other day-to-day requirements of the job.
Great, Dena. Here's one from you. This comes from April Strauss, Director of Business Intelligence, Decision Support, and Financial Reporting. April's asking if we're considering adding daycare to the medical center campus.
Currently, we don't have any plans to include daycare or childcare in the new tower in the medical center, but we will be discussing options for the vacated space over the next year. We're fortunate here that we have several daycare facilities available within 1.5 miles of the medical center. And also remember that Mount Nittany also offers payroll deduction options for flexible spending accounts to offset some of the childcare that folks may have.
Great, thanks. It looks like we have time for one more question this evening, but if there's more questions, keep submitting your questions. We're going to do everything we can to answer all of them. But for this evening, Dallas, here's a question. Why not renovate rather than take on all this new construction?
Well, we did ask and ourselves renovation versus new construction. With multiple people and departments being involved, such as the kitchen, breast care, MTU, co-ag, speech, and so on, it'd be much less intrusive to the patients and the staffing of these departments with new construction because of the limited space we have in the hospital, making the advantages of construction far exceeding the doing renovations.
Yeah, thanks for that. It certainly would be challenging to renovate while we continue to take care of patients every day. So it's great to be able to design from scratch and to build what we really believe the community will need for the next number of years. So once again, I thank each of you for being here this evening and for all the answers you have provided. Before we sign off, is there anything else anyone would like to share or add?
Kathleen, I would just say in closing, just as I kind of mentioned to you earlier, I mean, being in the people business like we are, I mean, this project is a commitment from the health system to our patients, to our communities, and to the wonderful staff that provide that outstanding care and service to all that we serve. So certainly we're all looking forward to it.
Well, thanks, Rick. And again, it really is a privilege to be able to participate in the development of something that will serve the community for many years to come. So thanks to each of you, Kim, Rick, Dallas, Dena, and Amber. Thanks for being with us this evening. Thanks for everyone who has tuned in. And thanks to all of you that submitted questions. We appreciate that as well. And with that, I will say thank you for all you do and have a wonderful evening.